Launching a business can take you on a journey unlike any other, filled with anticipation, uncertainty, and the constant search for answers. You're never quite sure what's coming next, which is why it helps to have a partner that does. Plan for the future of your business with the bank trusted by 50% of US-based, venture-backed tech and life science companies. Silicon Valley Bank, built for what's next.
Welcome everyone. We have a great panel in store on building an effective employee well-being strategy. I'm joined by David Ebersman, the CEO of Lyra Health, and Michael Callans, the VP of People Science at CultureAmp. I'm Kevin Diestel. I'm a partner with Sapphire Ventures, where I spend a bunch of time in a number of spaces, HR and anything employee related being one of those, and I have the privilege of sitting on the board of CultureAmp. I'm going to let David and Michael introduce themselves in just 1 second, but I did want to quickly set the stage here. I don't think it's a novel concept that the employee is the most valuable resource to any organization, but that often gets forgotten. An employee wellness side of things can fall even further down on the priority list, but that's changing as businesses realize that employee well-being has a direct impact on employee effectiveness. COVID has brought this to the forefront of things with work from home and a global pandemic, but these issues have been in existence and will continue to be in existence going forward, which is why I'm so excited to have CultureAmp and Lyra with us to join me as they are leading the charge in this front. So with that, I would like to thank you both, David and Michael, for joining us. And I'd love to have each of you take a quick minute to introduce yourselves. Maybe we can start with David, just walk through a little of your background and Lyra.
Certainly. Well, first of all, Kevin, thank you for putting this together and for including Lyra in it. We're grateful to be here. My name is David Ebersman, and about 6 years ago, I co-founded Lyra Health because we believed that employee mental health was one of the really important areas where we could improve the services that we offer to companies and to the people who work for them. We've been pleased to see over the past 6 years how many companies have decided that mental health is a priority and an area that they want to invest in better services. And I look forward to the opportunity to tell you more about what we're doing and learning as we go about supporting these companies.
That's great. And Michael?
I'm Michael Callans. I'm the Vice President of People Science at CultureAmp. And at CultureAmp, we are a platform for culture and people. And what we help organizations do is gain insights into their performance, into their employee experience through engagement and performance. We just signed on our 3,000th client a couple weeks back, and we're growing on that area. My background is in industrial organizational psychology, where I've worked with CultureAmp and a number of organizations around employee engagement and assessment.
Well, great. Thank you guys. Couldn't think of two better people and two better organizations to talk about employee well-being. So thank you both again for joining us. I wanted to start with just how each of you define employee well-being, because for some it can be a nebulous topic. And what do you really see as the problem statement? Maybe we'll start in reverse order. Michael, do you mind kicking us off?
No problem, yeah. So at CultureAmp, we have a very specific definition of well-being, and it's well-being at work, and it comes from the point of view of the employee. And it just goes as this: I'm able to develop my potential, work creatively, work productively, build positive relationships, cope with everyday stress, and make a meaningful contribution. And notice I said cope with everyday stress, not eliminate stress. There's some amount of stress that helps motivate and engage employees. So that's how we could define it, is, kind of to paraphrase that statement, is people feel that they can personally achieve by having fulfilling and meaningful work.
That's great. David?
Yeah, for us at Lyra, we're really focused on mental well-being. So we view mental health as one of the really defining problems of our day. In the United States this year, about 50 million people, about 1 in 5 adults, will have a diagnosable mental health condition like depression or anxiety or a related issue like substance abuse. And far too few of those people today find their way to effective care. Many of them don't seek care at all. If they do, they get frustrated with how complex and confusing the journey is, or they stumble into some treatment that really isn't helping them and isn't improving their symptoms. And what we're really focused on is trying to change that journey so that more people in need have the courage and the confidence to step up and seek care, and to make it really easy for those people to get connected to the kind of effective, evidence-based treatments that are going to improve their symptoms and help them live a better life and be able to be more productive and more connected at work.
Yeah, and I'm sure our audience is chomping at the bit to hear a little bit more about how COVID has affected these things. But before we get there, I think all of us would agree that this has been an issue well before COVID, and the different aspects of well-being, both the mental side and even on the engagement side. How do each of you measure success, and what is the impact of well-being for each of your businesses? David, let's start with you.
Yeah, the three areas that we start with in terms of trying to demonstrate and measure the impact that we're having. The first is employee engagement, is how many people are making the decision that they're going to sign up and use our services. So if nobody uses it, obviously we can't make an impact. We've been really gratified to see that really across every one of our customers, we've seen rates of engagement that were higher than we anticipated. There is inarguably, even before COVID, latent demand for people who need and want access to better mental health services. The second metric that's really important to us, we describe as access, which is how quickly can we get someone into care. So if you're struggling with something like depression or anxiety, you shouldn't have to wait weeks or months in order to be able to see a provider who's well matched to your needs. So we measure access to care in days from search to the first session, and most recently we're able to deliver that on average in about 5 days. The third metric that we really focus on is probably the most important, which is, do symptoms improve? So for what percentage of people who begin treatment with us, after they're done, are their symptoms for conditions like anxiety and depression or substance abuse meaningfully lower than their symptoms were when they started? And these are based on the individual self-reporting, how they're feeling at the beginning, in the middle, and at the end of treatment. And we're really pleased to be able to report that about 80% of people who get care through Lyra are able to achieve a meaningful reduction in their symptoms from the beginning to the end of care. So those are sort of the foundational things: getting people to use the service, getting them to care quickly, making sure the care is working. What that translates to for the employee are other measures that we can look at, such as lower turnover, higher productivity, a reduction in overall healthcare spend, that really speak to the value to the employer from the services that we're bringing.
And have you been able to draw that direct, concrete line to an ROI for your customers and users?
We have. It's been interesting to see how consistent and impressive the reduction in turnover is among people using Lyra versus the general population at the companies we work at. Productivities, as you know, can be a different measure from company to company. Often there's not sort of one thing that you can objectively measure. What we are able to do is take questionnaires that third parties have developed and validated that are widely used to assess employee productivity. And again, we ask people who are getting care through Lyra to fill out those productivity questionnaires at the beginning, in the middle, and at the end of treatment, and are able to demonstrate that people are self-reporting. They're feeling more present at work. They're taking less time off. They're feeling more capable of focusing on the work that they need to be doing.
Yep, no, makes sense. And Michael, you guys are taking a slightly different approach to employee wellness. How are you measuring the impact of well-being, or what is that impact, and how are you measuring success?
Yeah, well, as you said, it's more than COVID. COVID's had this great impact on all of us, but what people are going through and the way they're experiencing it isn't altogether different than the types of responses people have to other crises or adverse situations or adverse environments. So we think this is a time to learn a lot about how engagement and motivation are related to business outcomes such as customer experience, employee productivity, turnover, and retention. I'm going to kind of expand a little bit on what David had said in terms of being able to show the relationship between engagement and wellness and business outcomes. If you look at some of the research, the World Health Organization found that poor wellness, it it costs $1 trillion to the U.S. economy every single year, and that was even before COVID hit. So it's been an ongoing issue. When we consider success, what we want to look at is reduction in some of the adverse impacts, some of the challenges that come about as a result of poor wellness. So if we look at a 2017 Mercer study, we found that when they implemented a wellness program best practices, they reduced turnover by 11%. A study I conducted with managers, or we conduct with managers, about 6,000 employees, we asked them to rate the performance of their managers in terms of, do they respond to to them, are they available for questions and support? And we found that when an employee saw that their manager was not supportive, they're 4 times more likely to turn over, or in other words, or leave the organization. In other words, if a manager was supportive and listening and available, they're 4 times more likely to stay with the organization. So we measure success as a way to reduce the negative impact of poor well-being, or not having practices associated with fostering engagement and measuring engagement.
And so that ROI term that I mentioned would be, for you guys, would be more in increased engagement, lower attrition, more effectiveness, the elements of that, and then maybe tie even into the performance of the business. Is that fair, accurate?
That's fair. So first is measuring and creating awareness around where some of the issues with engagement or wellness may be, tailoring and creating these inspirations around where the trouble is within the organization, implementing some interventions to change that, and then measuring the change over time after those programs have been implemented. So where success is return on investment is showing an improvement in turnover, showing an improvement in absenteeism, showing an improvement in performance overall.
Got it. Now that all makes sense. And now, we've touched upon the sort of that the COVID impact, and that this isn't just a new and novel issue, but one that's been pervasive since the beginning of time. I do want to jump into COVID specifically, because the world today is different than it was yesterday, in an unprecedented period of just sheltering in place and working from home. How have what has the impact been to each of your businesses and your perspectives on well-being? David, do you mind if we kick it off with you again?
Yeah, if you are reading the media at all, it's not going to surprise you for me to say that 2020 as a year, COVID specifically, but not limited to COVID, has had a meaningful impact on many people's state of mental well-being. This has created a lot of anxiety, frustration, and concern that is manifesting among probably people watching this video, as well as your colleagues, your family members. So I don't think it's controversial to make that statement. And it's certainly consistent with the data that we've seen at Lyra. So since March, when really COVID started being something that people were understanding and worrying about as much in terms of the impact it was going to make, we've seen a meaningful increase in registrations across our business, probably about an 80% higher number of people coming and seeking care. The second thing that's been really interesting, again, not very surprising, is immediately we saw the baseline scores for people's anxiety go up. So people were worried about their future, about their financial well-being, about their jobs. One thing that we didn't necessarily anticipate but was interesting to see was depression scores kind of trailed a bit. So depression didn't immediately go up, but over time, as people found themselves confined in their houses, not being able to connect with things like exercise or going out, seeing their friends that bring them joy and break the routine, that people were starting to report meaningful increases in their depression scores as well. So we saw that take a little time to play out. And then another impact that I would say on the client side is obviously just a complete switch to video-based therapy. So Lyra operated before COVID in kind of a 50-50 world, where about 50% of people were getting care in person, about 50% by video. And in something that resembled overnight, that really shifted to something more like 100% video, which is interesting and something that we're well positioned to take advantage of. The one other thing I wanted to note is, in addition to the impact that we've seen on the client side, one of the things that will really define 2020 for us is the change in perspective from the partners that we work with, the employers. So traditionally, we'll go out and talk to employers about launching Lyra, and if they're interested in doing so, they'll launch us on January 1st of the following year. It's just a comfortable cycle for when you say yes, when you get contracts done, and when you bring forward new services to your employees. 2020 has really thrown that upside down, and we started in March having companies say, you know what, we want this service and we want it right now. And we weren't prepared for necessarily, or expecting, let me put it that way, to launch a bunch of customers in the middle of the year, because it's not what we've experienced in the past. But this year, during the course of 2020, we really doubled the membership of people who have access to Lyra through their employers. So I think mental health already had some very powerful tailwinds in terms of society caring more about providing better services to people in need. But I think 2020 has really accelerated that and really made mental health the kind of new category that most employers feel like they really need to be offering in order to support their employees.
Yeah, no, it's certainly top of mind, and even for myself, most people would characterize me as like very extreme on the jovial side of the spectrum, and I've even gone through ebbs and flows on this side. So I'm grateful for solutions like yours for sure. Michael, maybe take us through a little bit of the impact that COVID has had on the business.
Sure, and David mentioned a couple of times that things were not surprising in the way it's impacted, and maybe one surprise in there. And there was something that surprised us as we looked at the data when it had somewhat of a positive impact in some ways. When we look at our benchmark data, meaning the same questions being asked across time and across multiple employers, we found that there was actually an improvement in engagement in the first 4 months of COVID in a couple areas. One area being around leadership, and the other area being about taking action. And that surprised us a bit, and we wanted to understand why. So what we learned is that employees were looking for their leaders to give them direction and give them guidance and give them confidence. And we feel it's this kind of this rally cry to survive and to be productive and be successful. And also work offers a kind of a sanctuary against all the craziness that's happening outside of the workplace with the illnesses and the lockdowns. A disaster model, it really describes this as called the heroic stage, where you rally behind in order to get through it. But not to go too far with the positive end, because there's obviously some negative aspects that happen in terms of well-being. Where we look at leadership and action with a 70% satisfaction or favorability rating, the questions regarding wellness were well below 50%. In particular around areas associated with work and family balance, there's kind of this blur when you're working at home and your family's at home, and you don't know when work ends and family starts, and they overlap each other, and people aren't feeling like they're not able to get through what they need to do in a normal day at work and a normal day at home. We also saw, as David mentioned, that change. So we saw a change as time went on, where employees, as time went on, are not able to bounce back the way they had under normal times when they're in a difficult situation. That is, there was a sharp decline of about 15% in what we call resilience scores, so that they we might be moving from that adrenaline of the heroic stage into what's called the disillusionment stage, where employees they're feeling exhausted most of the time. They're having less discretionary effort towards work and family itself, and then measuring employees' feelings about returning to the office or traveling to the office. Only about 35% of employees felt safe traveling to the office, and about being in the office itself. And this was particularly worrisome for those that are caregivers. They're about 2 times more likely to give unfavorable ratings about traveling to work and going to workplace for obvious reasons, bringing back illness at home, leaving their loved ones unattended or not under their own care. So we're seeing that compared to non-caregivers, they're very concerned. But everyone in general are, if we look at it overall, most are giving feedback that suggests they'd be more inclined to work remotely today than go back to the office.
Yeah, no, for sure. Any last bits of advice you could give to managers and leaders who are in the audience listening to this now, and just how they could support their teams in a time like this, Michael?
Sure. So we look at interventions in 3 ways: the me level, the we level, and the us level. Me being, what can I do to improve my wellness? We being, what can my team and my manager do? And us, what can the organization as a whole implement systematic changes or wellness programs around that? So when you go through our engagement or wellness process surveys, our system will provide a number of recommendations on the type of intervention that would be most useful for them based on our data and based on how employees respond to the questions being asked. So if there's a pocket area around feeling of trust or feeling of loss, and then we make a recommendation of that. But a couple just things that may be helpful. One is have managers really help employees with that resilience piece, make sure they're taking time off of work so that they kind of recharge and rebuild, build in a way to make sure there's a separation between work and family so that they put the computer away or shut that office door or don't schedule meetings during evening hours, that you can be more flexible and less rigid, but expect the same amount of performance and performance and productivity goals. And then finally, help people make meaningful social connections. Most people, 90% of or a large percentage of their social interactions happened at work prior to COVID and working remotely. So how do you help organizations, how do you help your employees reconnect with one another? One thing we found is when you use we use gratitude. Gratitude is when you express appreciation for others. And we find that when employees express gratitude, they're more likely to have less stress, higher productivity, better engagement. So we start every meeting at Culture Amp with a expression of appreciation of others that have done something well for the team as a whole or for the community. So we recommend that as a process. The final thing is that measure your impact. Are you slipping towards that disillusionment, or everything's getting better? Create a baseline.
Got it. And David, anything to add there in the last minute here?
I think the most important thing I would say is that senior leaders at a company can make an enormous difference to their employees feeling comfortable reaching out, asking for help, seeking out mental wellness services by normalizing it. We see different levels of engagement across our customers, but the single most powerful thing that drives up engagement of our services is if a senior leader at the company is willing to get up and talk about it and really make it okay, and not a weakness for someone to need help or want to better themselves. So I really would encourage anyone who's in a leadership position who cares about this issue, who wants their colleagues and their staff to get help when they need it, to be willing to talk about it and make it not scary and not judgmental for someone to seek help. It really does make a consistent difference in terms of people's willingness to have the courage to step forward.
Totally agree, and that's why we're so grateful to have both of you on this panel, was because you're speaking to the CXO level folks who are supremely interested in just how to make change and support their teams. With that, thank you guys so much for joining us for the Employee Wellbeing panel, and thank you again one last time to David and Michael for joining us. Bye.